traveling for medical procedures is becoming quite the phenomenon. In 2008, an estimated 125,000 people came to the U.S. for healthcare. But today, medical professionals say not only has the number increased, but the procedures have become more advanced.
The majority of the people that come for medical care to the University of Miami have advanced medical problems that they feel more comfortable being taken care of here under our expertise for whatever reason. So those are many times individuals with complicated advanced disease that come from all over Latin America and the Caribbean. We also get people even from Europe and the Middle East. Now we're starting to get a certain degree of patients that are coming from Asia.
Cosmetic surgeries aren't the only procedures drawing in overseas patients. Today, organ transplant is becoming most common. In South Florida, the University of Miami's Bascom Palmer Center attracts international patients.
The majority of the people that come to us as a single disease line is still ophthalmology. A lot of people come to the University of Miami for that field because we have the recognized Bascom Palmer Eye Institute.
Northeast Florida is also gaining ground in medical tourism. Visiting patients brought a $23 million boost to the area in 2012. Many are drawn to the world-renowned Mayo Clinic and UF's Proton Therapy Institute, which is an alternative to chemotherapy for cancer patients.
I can tell you, as my past life as a travel agent, we used to package deals for people to get mostly aesthetic things done out of the country. And we've been seeing a growing number of people that are doing the reverse. They're coming here to get their care.
With medical costs rising, many Americans are seeking health care outside the U.S. But those that travel to the United States are coming with international insurance.
Maybe eventually, yeah.
About 10 years ago, or a little bit more, about half of the patients that came were self-pay patients. So basically they came, these were basically relatively affluent patients and so forth. As the world became flatter and we started doing more international care all throughout, then people started using international insurance companies. So now I would say 2/3 or more of our patients are insured, and they're coming with international insurance for care here. So that's one of the recent changes.
We work with a number of international insurance agencies. There's also a certain percentage that pay out of pocket as well, and they're willing to do that to get what they need. That's not found in their own country, or they have experience is maybe perhaps different than what they're accustomed to.
Doctors say international patients are also looking for quality of care and safety over costs.
We're also seeing people who believe that the American medicine and evidence-based medicine that they seek is found here and not at their own countries. So I think for a multitude of reasons, they're coming here to get their care, and we're seeing more of them approaching us.
As technology progresses, medical experts say there may not be a need to travel one day.
We already use telemedicine in several different ways, whether it be through the internet, which is more and more and more used, especially when communicating between what we do here and then when the patient goes back and sees their own physician. So we either communicate through the internet, we communicate through the phone, of course, but we also have our telemedicine department. And as countries develop the technology, they're able to use that technology to communicate with us.
There have been cases done in Milan, which are being, the patient is actually in New York or the other way around. I mean, so there is a possibility of doing that technologically in certain fields. And, you know, with robotics the way they are and with our telecommunications getting to be the way it is, it's more and more likely that these things will occur.